welcome our panelists who are building institutions where clinical care and business performance go hand in hand. Mr. Anuj Gupta, CEO, ClearMedi Healthcare. A huge round of applause. Dr. Anuj Tiwari, Group CEO, Sparsh Hospital, Odisha. Dr. Santosh Pandey, CEO, Tata Steel Medica Hospital. Dr. Suchin Bajaj, Founder Director, Ujala Cygnus. This session will be moderated by Mr. Vishnu Saxena, Founder and CEO, Digital Health News and Scale Health Tech. Welcome everyone to the stage.
Great insights from the previous panel, the CIO panel, what it takes to transform a hospital, the building blocks, the previous panel. And I really appreciate, Sudeep and Mr. Vashisht for validating, the DHP, the platform that we are launching in order to make the life of hospital CIOs easy and also enable our innovators and transformers, see the light of the day really quick. So appreciate your validation. Thanks for that. So here we are on our very exciting panel. It's called Happy Patient Healthy Margin. How important is the consumer experience, for the hospital CEOs? So this is the leadership panel. We got Mr. Sandeep Pandey from the Tata Steel Group Hospital. Mr. Anuj Gupta, he is from ClearMedi. He's the Chief Operating Officer. Dr. Suchin Bajaj from Ujala Cygnus, and Mr. Anuj Tiwari from Sparsh Hospital. So maybe if you guys can do a real quick round of introduction besides what I spoke, that will be great, and then we'll get started.
Yeah, good afternoon, everyone. Let me introduce myself. I am Dr. Anuj Tiwari, representing Sparsh Healthcare. We are one of the oldest private organization across East India, or particularly you can say in the state of Odisha. Sparsh basically is a group of hospitals. As of now, we have good number of hospitals and plan to expand to 2 more heavy beds. We also have Nursing and Allied Services College and pharmacy chain and chain of clinics. Parallelly, we have lot of ORCs around, you can say, and information centers nearly accounting for around 50 to 70 across Odisha. So, we are chain of hospitals, clinic and college. And I represent Dr. Dheer and Sparsh. Thank you so much.
Thank you very much. My name is Suchin. I am also a doctor by training. I am the founder of Ujala Cygnus Group of Hospitals. We have 28 hospitals across 6 states of North India, catering mostly to communities that do not have access either due to financial reasons or geographical reasons or social reasons. Our aim is to completely dissociate access to high quality healthcare from these liabilities or limitations that the communities face. We also run nursing colleges. We also run DNB programs. We also run a lot of upskilling and training programs for doctors, paramedicals, etc., including degree, diploma programs across all our hospitals. And our aim is to increase to around 50 hospitals across 9 northern states by 2030.
Hi, good afternoon. My name is Anuj Gupta, and I work as Group CEO for ClearMedi Healthcare. And ClearMedi Healthcare is one of the fastest growing healthcare organization in the country right now. I mean, from 200 beds a year and a half back, today we are a 1,000+ bed hospital. We operate at 7 hospitals across the country. And for myself, I have 25+ years of experience in hospital operations. I worked with multiple other hospital groups before joining ClearMedi. Thank you.
Hi, good afternoon, and I'm Dr. Santosh Kumar. I'm the CEO of Tata Steel Medica Hospital, which is a joint venture between Tata Steel and Manipal Group of Hospitals. So, you might know that which is situated in the Kalinganagar near Bhubaneswar. So you might know the Tata main hospital in Jamshedpur. So our main clientele is of course Tata Steel and the ecosystem. So Tata Steel Jamshedpur is a 1,000-bed hospital, and ours is the steel plant is 3 times bigger. Which is instead of India's largest steel plant in the country. So that is the canvas for our hospital. As a professional, I am trained hospital management and person, and having more than around 28 years of experience in entire spectrum of healthcare organizations in India and the Southeast Asia. Thank you.
Excellent. I love this panel and love the topic. So thanks for the great introduction. Now, moving to the topic, I just wanted to give a little context to our audience. So we are in the age of consumerization, right? The way we shop, the way we bank, the way we book our hotels, and by the way, the Blinkit thing, the Blinkit, the way we order like grocery within like 9 to 10 minutes is at our home. So we are into hyper consumerization world in other industry, minus the healthcare. So what we are happening is, the way we shop, the way we bank, the way we travel, we are bringing our expectation from the other industries, and we are demanding the same from the healthcare, right? Now, and this is the topic, and the reason we wanted to have this discussion with the hospital CEOs is because, how important for the hospital CEOs the consumer experience piece is. Because, of course, as a most populated country on the planet Earth, our hospitals are running, over capacity. If each one of the, whether Dr. Bajaj, Dr. Tiwari, Dr. Pandey, Mr. Gupta, if you're open, like a bunch of hospitals tomorrow, they will run beyond capacity, right? Because of the demand. But things are changing. People are demanding, like convenience, access, great experience, right? So the patient is at the center. Like there's a lot of eyes on that one patient, whether they go this hospital, whether they go that hospital. So things are changing, right? Now, I wanted to ask this question to you, is that how important, maybe Dr. Tiwari, you can start. And, you all can chime in. How important is that the consumer experience piece is? Because, there is a statistics to it that better experience drive better patient outcome, right? It helps drive better revenue. The hospitals that provide a better experience to their patients, they generate close to 50% or more revenue. It takes less time, it takes less money to essentially retain a customer than acquire a patient, right? So, as a business leader, as you all are leading hospital, how important is the consumer experience piece? Dr. Tiwari, you want to start?
Yeah, consumer experience. For you, the word consumer is there. For us, we don't like the word to say as patient. It is also a person who needs care and attention. I hope everybody agrees on that. So, yes, experience counts. Like it is said that people want services within 10 minutes and they expect a hospital also to deliver the services within coming next 30 to 50 minutes. And we team leaders sitting on the dais, we have good people on the dais. We all, and here also, we all try to deliver the best of the best. I think so. This is yours.
Slowly.
So, what do you say is experience of the customer? It starts the time when he is sick and he is interested in your brand or your healthcare body, and you try to reach him. It may be at home, it may be during the transit, it may be on arrival to the hospital, or it may be during the hospital or post discharge of the hospital. So there are much variants where you can serve the patient to the best of the best. Apart from what you say is giving a good clinical domain, a very specific skill set, and treating the elements of the patient. For example, if short and sweet live example, how we all sitting here try to improve the services. Suppose anybody is having a heart attack at home and your hospital is just anyhow near about 3 to 5 kilometers. You can save the person. What happens generally? They try to connect on their own vehicle, or if you have good ambulances, designated lines, circulating ambulances which can be at your doorsteps at a very fast pace, avoiding all the traffics. what generally happens, a person give a call, hey, I need help. I think so something is wrong. We guys try to reach at the doorstep at the earliest, back to the hospital. And what is the transit time? We gather all things of patient centricity to the same goal. For example, what I can say is in heart attack or any sort of things, the most important thing is getting the patient on the right time within what you say is 30 minutes, 5 minutes, whatever possible. And checking the ailments and if possible, going to cath lab for an intervention. So we try to cater to the door to balloon time. That is what is the gold standard for a service which hospitals and we all team leaders try to deliver. Something you would like to highlight on other part of the service?
Yeah, I agree. See, at Ujala Cygnus, for us, patient experience is not just a service parameter. It is actually a very strategic driver of healthy revenues, strategic growth. And for us, service encompasses everything from right when the patient starts to look at us in the discovery mode on how he discovers us either through digital or through word of mouth or by walking into the OPD, to the fact that when they are discharged and post-discharge follow-ups, everything. And if a patient experience is good, it will drive trust, it will drive referrals, it will drive retention. And in the low income and low access communities that we work in, trust is the main currency. Trust is everything. If you trust a hospital, you will go to any lengths to access that service. And once that trust is gone, there will be no more patients. So technology, I truly feel, is an enabler for us, but technology is not really everything. In our communities that we work in, a WhatsApp message from your trusted doctor or your trusted nurse works much, much better than an app notification from an unknown app, right? So that is why we go for patient experience to places where our patients are already present. We go village to village, we go to WhatsApp, we go to SMS. The community is already there. We don't want them downloading apps because also we understand that in the communities a smartphone is a shared resource. It is not that everyone has two smartphones here. That is not the case. Usually in our communities, one family has one smartphone. So we go where the community is already present. We don't want them downloading apps. We don't want them traveling to our hospitals. We want to go where they already are and build trust from their community rather than them coming to us.
Excellent, excellent. Mr. Gupta? Yeah.
So I think it's a very important piece. Trust is very important, and in any healthcare setting, word of mouth is one of the important piece. And most of the patient still in the healthcare in any hospital come through word of mouth. If you look at the overall patient share, 60 to 70% of patients come to the hospital through word of mouth. The remaining 20-30% would be because of the digital effort or because of the sales or marketing effort. So these 70% patients are basically coming because of the trust of the hospital, because they know that this hospital provides the better kind of service care. It could be the hospital, the kind of services which hospital provide. It could be because of the doctor. It could be because of multiple other factors, or it could be because of the geographical location of the hospital. So 70% of the patients are coming to the hospital because of the hospital overall, hospital experience which they get at that place. So that's why I think having a better experience or giving a better experience to the patient is one of the most important piece.
Totally. Great.
And I definitely agree with all my co-panelists. But two things I would like to add. One is that why it is important in healthcare rather than other, like in products and all that, the consistency of delivery is quite same. But in healthcare where the provider, there are different providers, they say that for one patient, for 3-4 days, there are more than 30-35 different care providers with different educational background and all the skill set they come. And there lies the difference of kind of experience the customer has to or patient has to happen. And therefore, it is very important that how to kind of bring everybody aligned to the care where consistency for every patient is same and same patient coming for next time, every time, same level of experience is given. And second thing is that, especially for our kind of setup, where we know that majority of our customer will be from the Tata Steel or neighboring people, where even in our case, a lot of tribal patients are there. But still, they are very smart and they have a lot of options, because now even the insurance companies are giving insurance and all that, so they can go in anywhere. So why would they come to any specific hospital if they are not getting the value, personalized care, the respect, and the the kind of interaction they are expecting from doctors and all that? If that doesn't happen, they will not come to a hospital. So definitely, as you rightly said, that customer experiences is reflecting on the ROI of the organization, and therefore it is very, very important. Thank you so much.
Excellent. I'm very encouraged to see a unanimous, consensus here that experience is important, and you guys are focusing a lot on experiences. Dr. Bajaj, you mentioned, trust. Dr. Gupta, Mr. Gupta, you mentioned relationship. You chimed as well, and Dr. Tiwari, you also, absolutely. Now, what we call it, like trust and experience is important for engagement to happen. Whereas a personal life, whereas a healthcare, better patient experience is a prerequisite for a great engagement to happen. No experience, poor engagement. As simple as that. Now, we all know now, today, the patients are not just seeking the care. They want experience. They want experience which is fast, seamless, digital, personalized. Patients want they to know you. So patients want their hospitals to know them. When I call a hospital, they can say, oh yeah, hello, Mr. Vishnu, how I can help you? They should greet me by my name, right? They should have their patient data, okay, so have you done your test, Mr. Vishnu? These are your reports. And I'm scheduling your follow-up appointment with Dr. XYZ. So the point is how we can provide that experience, which is important, because the loyalty these days is built on trust and digital, so hospital cannot lag behind. My question to you, let me start with Dr. Bajaj with you, is how you approach building a patient experience as a core element of your business strategy, and who drives that? And important, and of course, you are into urban area, you are also into suburban area, where you have a mix of population. There are certain educated population who are more technology savvy, they can handle the mobile app or something. There are certain population that is not that technology savvy, digital savvy. So the first question is how you institute consumer experience, like patient experience strategy here as a part of business strategy, and what kind of tools and technologies you are implementing to provide that better experience.
So what we really stress upon is hyper-personalization of each and everything we do. And we have only one ethos, that each and every one of us should treat all our patients like they were our own first-degree relatives. So whatever happens, if my father was lying on that bed,
Well, that was interesting.
wonderful.
Really appreciate that kind words. Let's get back.
So what if my father was lying on that bed? What if my mother was on that wheelchair? What if my brother was going through that surgery? This is the question that we should all ask ourselves while interacting with the patient. And then I am sure the number of errors that we do will be minimized. Second, as I said, we do a very digital front and a paperless kind of an experience for the patients, because hyper-personalization has its own limitations that you cannot really scale it up. And if you want to scale up personalized efforts, then digital is the only way to go. So you need to have a mix of both technology and community playing both their equal parts. So what we try to do is a mix of artificial intelligence and community intelligence built into our patient care programs all across, from right when we meet them in their village. We have a program called the Sehat Chopal, where we go village to village every day. So we cover almost 30 to 35 villages every day through our outreach programs, through the Sehat Chopal programs. We go and meet them, and in each Chopal we meet about 100 to 150 patients. So we are screening about 3,000 to 5,000 new people every day and creating the first touch point with them. And then when they discover us through the digital platform, when they walk into the door, when they start availing our services, this whole patient experience program builds a lot of trust into the system, as I said. Each and every interaction has to be personalized, has to be catered to the particular person. And when you are discharged and in the post follow-up, I was talking to my friend earlier in the previous panel, and he was telling me his father has gotten discharged 3 or 4 times from the same hospital in a big city. But he says every time then we completely lose touch with the hospital, and then every time, next time he has a problem, we have to go back and start afresh all through, right? So if a hospital can keep in touch with you during that, not only will you have a better experience, but your next admission will definitely be delayed, if not prevented altogether. So we've seen that a lot in the NHS. I think we are about 10, 15 years behind them. If you see the NHS in the 1980s, the data was that there was about 10% admission rate for all COPD patients. So 10% of all COPD patients would get admitted every year. That rate has gone down to less than 1% with this digital scaling up, empowering of the nurse practitioners, empowering of the GPs, the experience that you can get on a day-to-day basis instead of just approaching the specialists in the hospital on a need to take care basis. So what we are trying to do is completely transform sick care that we are currently doing into real healthcare. The preventive part of it, the day-to-day interactions, making sure that you take your medicines on time, making sure you don't miss your appointment. So see, a missed appointment is not just an administrative failure. It is a sign of something much deeper. It can be financial stress. It can be just depression. It can be just, I'm sick and tired of managing this chronic disease. I won't go anymore. So just seeing it as an administrative failure that the patient didn't turn up for the appointment, you have to really go much deeper into making sure you understand what the patient is experiencing. So this real hyper-personalization of each and everything is at the core of everything we do.
I'm loving it. Real hyper-personalized experiences in a hospital chain serving urban and suburban population, and Sehat Chopal with a high touch, and like we call it like high tech, where we are going to talk about the digital front door, but then you are mixing it with a high touch so that the people who are underserved, they can be, included into that ecosystem, and they can say, oh yeah, that's a great hospital. They take care of me, and, I'm going to go there. So great. Thank you, Dr. Bajaj. Dr. Tiwari, Asperge operates in Odisha, great state. And you have mix of urban and rural population as well. When it comes to the first touch point, how important it is for you, because your patient population is also in rural and, Bhubaneswar and Cuttack and all, if it's urban areas. So do you have a digital front door strategy or like a consumer experience strategy, and how you are actually reaching out to them? Do you have any front door technology, patient engagement platform or something like that? Can you give us some insights in terms of what is the first touch point for a special hospital for the patients?
Thank you for this fabulous question. Yes, this generation, or nowadays you can say, apart from whatever my colleagues have said, that pivotal points, touch points, this technology points also plays a very important role in taking care of the patients in multiple aspects. At Sparsh, we do believe that technology, getting connected to the patients, plays a very important role in delivering the best possible care to the patients. For example, right, Dr. Bajaj has said in the past that some of his relatives are known to was having a situation where they used to approach the hospital and they were stuck up what to do, why, and they used to check the records. So there is a electronic medical record system available across many hospitals, including Sparsh, where just you have to bring the UHID or some sort of IP number or either mobile number, which is connected with some other records of the hospitals. You can link to all the available past history records available of the patients, which always is beneficial to the patient, so that he doesn't need to take care of this much bundle of books or papers along with him and search for a doctor and come. Likewise, you can say, there are n number of examples. So there is a EHR, EMR, and you can say now, if the patient is at home, the hospital is still having its records preserved, safeguarded, but yes, he wants to connect to a doctor. What he will do? So there are multiple channels which is available at Sparsh and others, where they just book an appointment via app. So apps are there. Hospital provides a nice app which is having multiple segments. Like one of the segment is just an OPD, getting a slot appointment in the system of the hospital through an app. Parallelly, suppose you met the doctor and everything, he has advised you a blood test. Now what? Again, you have to go to the vicious circle, go for the billing counter, go for this, go for that. No. So there are payment modes available in the app also. You are advised, suppose you have a less hemoglobin or something, some ailment with you, and you went home, you want to check your records. You want to check your pathology reports, X-ray reports, you are having cough. So that is available on the app via lab or radiology module. So there are much aspects where we can cater to the needs of the patient through IT, and it is always beneficial. Yes, the touching point is always human. In healthcare, that is pivotal. Yes, but definitely IT and technology plays a very definitive and helpful role in developing that clientele and clinical expertise.
Excellent. Loving it. And I think it is not a choice anymore. So, so you have to meet the patient where they are, and through the technology, through the app or through the portal. Mr. Gupta, question for you is, ClearMedi is also a chain. You are also a disruptor, mix of urban and suburban population that you're also surveying. Now, as Mr. Tiwari was saying, through IT so my question is, twofold. A, what is your consumer/patient engagement strategy? How you are reaching out to your patient population as the first touch point? What kind of tools and technology that you have? Now, how you are making that more personalized? Because, somebody needs certain things and somebody needs different things, right? One side doesn't fit all, because the consumer experience has to be personalized. For example, pediatrics, for example, terminally ill, or, the mother, right? So how you're, contextualizing those experiences?
So at ClearMedi, in terms of digital or automation, what we have done is even before we actually expanded ourselves as an organization, we have acquired an HIS. We had a full-blown HIS in our system. We had an EMR, which is already there existing in our system. We have Power BI, through which we see a lot of data sets. So there are tools which are already available in the system through which we can track the patient outcomes. There are digital dashboards which we have created where we monitor the overall TATs of patient, the TAT of discharge, TAT for admission, or TAT for any diagnostics. So these are multiple things which we have actually undertaken as an organization to touch base with the patient. Now we have actually divided the patient journey into 3 different aspects. One is the footfall. So footfall meaning the footfall coming into the system from various sources. It could be through the digital source, it could be through the referral source, or a patient coming through a call center, or for many other mode. So that is one piece. There's another piece which is basically conversion. Conversion is something where, when the patient comes to the hospital through the OPD, how is the OP to IP conversion? How is ER to IP conversion? Is there any patient who is dissatisfied there? So we look at all those things. If the conversion is not happening, in spite of patient being advised surgery or admission, that means there is some issue there. So we look at that particular issue. Then the third piece is retention of patient. So this is one of the most important piece where after the discharge of patient, most of the hospital don't even follow up. So what we have started doing at ClearMedi is we have introduced a system called as integrated health officers. So there are people who are actually available in each of our units. In 7 of our units, we have got 2-3 people whose job is basically to look at only the data of the patient who are actually gone out of the system, who got discharged, and who have gone home. In fact, we segregate them on the basis of their medical conditions. So like what you were talking about, how do you segregate and identify? So we segregate high-risk patient who are at moderate risk, and patient who are at low risk. So high-risk patient or moderate risk patient, say a patient who is hypertensive or who is diabetic. So that stratification automatically happens in our system, in our solution, and through which our integrated health officers' job is to identify those patients, give a call to them. It is not only for follow-up, it is also for checking on their own well-being, how patients are doing. And sometimes it happens that some of these patients are actually, hypertensive, the diabetes is deranged. So we actually advise them, please come to the hospital, to your nearest hospital or to our hospital, take the treatment and go back. If admission is required, then go for admission. So, this is one strategy which we have adopted, and in fact, we are seeing a lot of improvement in the overall system. Earlier, post-discharge patient, if I talk about the percentage, so 15 to 20% patient would come back to the hospital for consultation. But now, after implementing this whole process, we are seeing close to around 35-40% of patients who are coming back to the system. So that's a great achievement, I feel.
Super, loving it. Recapturing the patient demand, they have been seen. Otherwise, as you said, like you have a follow-up. We often call it like patient engagement is broken, but I think it is important that to follow up and recapture if they are at the verge of losing. We have time's up, but Mr. Tiwari, if you can chime in for the 30 seconds or less.
So, so what I think we all have the same kind of features in our use of digital technology and all that. But what we are going to again integrate is like measuring the outcome of the customer. Once the patient gets discharged, it is very important to know what happened after that, especially for the surgical cases and all that. A lot of time readmission happens and all that. So the PROM, lot of new methodology has been adopted and being used in hospitals. So we have started trying to digitalize that, and through a digital forum, capturing the patient responses about what happened after 6 months, after 3 months, and then analyzing that to improve our clinical outcome. That's where, and the another point is like during the care, especially what happens is the patient is shifted from ICU to SDU. And many times what happens in SDU, the patient condition get deteriorated and care doesn't happen. So we are, through different SOFA score, digitalization of those things, we are able to identify and preempt the risk, and then again bring the customer to the ICU and all that and provide the better care. So these are the things, apart from all which has been shared by co-panelists and all that we are implementing in our hospital. But one thing is, again, I just, at the last point is, being part of this big group is that we don't have to justify the investment into the IT digital, because the big companies knows about that, and it is just driven. If you just put up anything which is beneficial to the company, anything which adds to new customer, the board is always for you.
Super.
Thank you.
So the patient experience is the new battleground, right? So better experience, better outcome for the patients as well as the business. So round of applause for our great speakers. They are driving the consumer experience, patient experience, their enterprise. So through technology and empowering their patients, empowering their clinicians and staff. So thank you so much. Appreciate it.